So this is a typical NICU patient room. Today we'll be talking about a few particular pieces of equipment that are in the room, including the incubator, which you see in the middle of the screen, the monitor. There is a respirator, ventilator behind, which we'll take a closer look at. And then finally, we'll be taking a look at the nursing med cart as well. We'll start with the incubator, which is also sometimes called an isolette. This can be a somewhat intimidating piece of equipment if you haven't been in the NICU before, but really it's designed to do a few really important things that are crucial for taking care of particularly our premature infants. The main job of the incubator is to keep the infant warm. It also maintains stable humidity and really kind of allows for consistent containment of all the pieces of technology that go into taking care of a premature or sick infant. You'll notice that if you look really closely that the incubator itself is made out of plastic. You'll see that many of the walls are actually double-walled, and when you look at particular pieces of the incubator, you can see that it's got kind of plastic that's designed to really keep a tight seal and to keep air from moving in and out of the incubator. You notice that I just opened the incubator, and there are a couple different ways to do that, which I'll show you here in just a second. The first way that you'll be able to open up this incubator is if you look down at the floor, you'll see a pedal down there. That pedal, if you step on it, activates the top, and it allows that top to open up all the way up, and that gives you nice access in to get to the patient if you need to get in there to do an examination, if you need to get in there to provide assistance if the baby's not doing well. That top can also be opened. If you look on the side of the incubator, there's a little set of buttons. The top one opens, the bottom one closes, so if we push that button, we'll see that top starting to come down. The other thing I would point out as we're opening up the top, if you look up at the very top, as you get the incubator all the way open, you'll notice that there's a radiant heater that opens up. You can imagine when that top is opened up that we can't contain the heat within the incubator, so that radiant heater is there to help provide some additional heat to keep the infant in a stable thermal environment when the top is open. Temperature control is a really important part of what we do in the NICU, and this incubator is designed, at least as one of its primary purposes, to do that. There are a number of different types of heat loss, including convection, conduction, radiation, and evaporation, all of which we'd ask you to look up on your own at another time. But the incubator is designed to prevent all of those things. The other thing that you'll notice is that there is a number of ports, and I'll zoom in on that for you, that you can connect monitoring devices to. These can include things like a temperature monitor, and that you can see right in the middle of our setup here. There's a little probe that would plug into that port, and that's placed on the skin of the infant, and that allows the incubator to have information so it can auto-adjust to keep the temperature of the infant stable. Some of the other things that you see placed in the incubator here include connections for setting up heart monitoring probes. This is a connection for a pulse oximeter. There's a blood pressure cuff, and this gives you an idea of the size of some of the infants that we take care of in the NICU. This is actually a bigger one than some of the ones that we use. And then there are a number of other pretty commonly used pieces that are set up in the bed here. Another really important piece of equipment that's in every patient room is the bedside med cart. These are stationed in every single patient room, and they have some key supplies that the nurses are going to use when they're taking care of patients. Now, once we get into the med cart, you'll see that there are a number of typical supplies in there. These will be things like equipment to start an IV, little cotton swabs if there's a IV poke and blood, normal saline for flushes and for cleaning things off, things like alcohol pads, saline that can be used for suctioning on a ventilator. And there are a whole host of other things in here. I would say that these are things to be familiar with. Again, things like syringes are in there. If you need to get access to any of this equipment, please talk with the bedside nurse before you get into it. Again, it's going to be key locked, so usually it'll be closed, but do ask your bedside nurse before getting into the cart. All right, another piece of essential equipment in the NICU is the ventilator. This is another piece of equipment that can be really intimidating for folks, but there are some basic things that are worth being able to recognize and know where to get the information if you need it. So this is the main screen that you'll just see displayed on the ventilators that we use. You'll notice that there are a number of key pieces of info that are displayed right away on this first screen. The things that I would point out particularly are, if you look at the bottom of the screen here, you'll see numbers that tell you what your fraction of inspired oxygen are. This patient happens to be in a pressure mode, and so it has a peak inspiratory pressure, an I time, which is measured TI, respiratory rate, PEEP, and then a slope, which is a more advanced piece of setting that we don't need to talk about today. If you look at the rest of the screen, up at the very top there, you'll see it says PCAC, so that's a pressure control assist control mode, so the mode that you're in will always be displayed up there. The ventilator will also give you some numbers across the side that tell you important things like, again, your fraction of oxygen inhaled, your peak inspiratory pressure, which you'll see changing from breath to breath here if you watch it for a minute, and then the tidal volume. So if you're in a pressure mode, you'll see a tidal volume displayed. If you're in a volume mode, you'll see that pressure displayed, so it kind of gives you feedback about how the patient's doing with the ventilator. As we look at the middle of the screen, you'll see a flow volume curve, which can be important in seeing how the patient's interacting with the ventilator. And then we also see a flow curve, a flow over time sort of curve that tells you how the breaths look over time as well. The patient monitor is another essential piece. You'll see these throughout the hospital, just about anywhere you go. We'll go through a few particular things, but I want to point out just a couple important pieces and little nuances that are particular to the NICU as we look at things here. So as we look at the monitor on the main screen here, you'll see a number of important numbers. The first one at the top, you'll see labeled as the heart rate. That actually gives you a full rhythm strip, and that's typically for about a 10 or 15 second period depending on what your settings are on the monitor. This patient actually has pre- and post-ductal oxygen saturation probe on. Most of our patients will only have one oxygen probe on, but this is giving you kind of a continuous reading of what the patient's oxygen level is. In this particular patient, you can see that we've got two probes on because this baby has congenital heart disease, but one important thing to know is that the monitor is always averaged over a certain period of time. In the NICU, it's typically 6 seconds. In adults, it's often 12 seconds. So that number you see displayed there at the right, that 99, is actually a few seconds behind what's happening in real time. And then finally, that white line, that's your respiratory pattern. And so the number will tell you how many times a minute the patient is breathing. Looking at the height of those little curves will tell you how deep or how much the chest is moving as the patient takes a breath. There are two particular additional settings that I'd like to point out. The first one is something called the histogram. If we push on that button, it'll bring up an additional screen, and this tells us how much of the time the patient is spending in different oxygen saturation categories. If we zoom in on this patient, this is a patient that has low oxygen saturations, and you'll see that about 32% of the time in this patient, the baby is less than 80% on their oxygen saturations. Now, this is atypical, again, because this patient has heart disease, but you'll want to look at this to see, is the patient getting the right amount of oxygen? Do we need to titrate down, titrate up? Do we need to change things like the CPAP or other settings on the ventilator if those numbers don't look good? And the final piece I would like to show you is something called the event review screen. So again, on the bottom, if you click on that button, it'll bring up a display. This patient doesn't have many, but a lot of our patients, you'll see a number of little yellow or green marks on the screen. If you go into the Show Episode button, it'll actually bring up that particular episode when the alarm went off, and it'll tell you what was going on with the other vital signs at that time. So that's important information when you're trying to sort out, was this a baby that had apnea of prematurity? Was this an episode related to reflux, or whatever the cause was? Being able to go on that screen and review the actual event is a very powerful tool.